Great, thank you. Well, hello everyone. Thank you so much for being here today. For those of you who I haven't met, my name is Alicia Annamalay, and I lead our monitoring and evaluation work here at the Max Foundation. On behalf of the entire organization, I'm very honored to share some highlights from our 2024 monitoring and evaluation report with you today. So many of you in the audience are our valued partners and collaborators, and we thank you for your support and hope you enjoy seeing the impact we've achieved together. For those joining us for the first time, welcome. We hope this presentation gives you a deeper understanding of our work at the Max Foundation and inspires you to join us in advancing health equity around the world. We will have a Q&A at the end of the presentation, and we welcome any questions, comments, or reflections you may have. So for the benefit of those who are less familiar with our work, I'd like to begin with just a few slides to introduce our mission and our approach. The Max Foundation was founded over 25 years ago in memory of Max Rivarola, the beloved stepson of our founder and CEO, Pat Garcia Gonzalez. Max and his family moved from Argentina in search of treatment for his chronic myeloid leukemia. Tragically, he passed away in 1991, just before the introduction of imatinib, a life-saving medicine that transformed CML treatment. Max's legacy continues to inspire us, and we honor him through our commitment to advancing health equity globally. So today, our mission at the Max Foundation is to accelerate health equity, and we do this by delivering medication, technology, and services to patients facing cancer and other critical illnesses, focusing our energy on those no one else is helping. We believe in a world where all people can access high-impact medicines, where geography is not destiny, and where everyone can strive for health with dignity and hope. So to serve our mission to accelerate health equity, we structure our programs in three broad areas. Through our flagship program called Max Access Solutions, we channel medicines to patients living in low and middle income countries in partnership with their physicians and treating institutions. Beyond access to treatment, our programs support health systems strengthening through programs in diagnostics, healthcare professional capacity building, and patient advocacy, as well as social determinants of health to address adherence, transportation, and psychosocial support for patients. So this year, we've continued to refine our M&E framework, expanding our approach to more fully reflect our impact, not just on patients, but also on health systems and the value of investment. There are three main objectives in this year's M&E report. First, patients. Our goal is to ensure people facing cancer and other critical illnesses in low and middle income countries receive timely, sustained access to high quality medicines that improve survival, quality of life, and economic well-being. Second, health systems. We work to strengthen local health systems by expanding access to diagnostics, building the capacity of healthcare professionals, and supporting quality care delivery. And third, value of investment. We're focused on making the most of every resource by improving efficiency, managing risks, and showing the impact of our partners' support. Today, I'm going to share just a few key indicators from each of these three objectives. So let's start with our first objective and the central focus of our work, patients. Our goal is to provide treatment and care to patients facing cancer and other critical illnesses in low and middle income countries, ensuring timely and sustained access to high-quality medicines that improve survival, quality of life, and economic well-being. So the aim of our first indicator is to measure the number of patients reached through at least one of our programs. In 2024, we reached 39,658 patients worldwide. This includes patients supported through Max Access Solutions, our treatment access program, our social determinants of health programs, our treatment-free remission or TFR support program for CML, as well as accompaniment services, which refers to the personalized support our team at Max provide patients through direct contact. So this number represents a 7.4 increase from 2023. Notably, more than half of patients received not only access to treatment, but also support through accompaniment services, as shown in this figure by the light blue area. So this reflects our holistic, patient-centered approach that goes beyond medicine to address the broader needs of patients. We're able to report robust patient-level data for most of our programs, thanks to our in-house patient access tracking system, PATS, which captures data directly from patients and partner physicians through our team on the ground. By measuring who we reach and how we reach them, we are better able to ensure that all patients, regardless of geography, receive the support they need to access treatment and care and achieve the best possible outcomes. We also measured how many patients received treatment through Max Access Solutions and how many new patients accessed treatment for the first time. In 2024, a total of 37,248 patients accessed treatment, with just over 4,000 receiving treatment for the first time. Since 2023, the total number of patients accessing treatment increased by 6%, while new patients reached increased by 20%. Something we are deeply proud of at the Max Foundation is the long-term support we provide to patients and their families. Our commitment doesn't end at access. We walk alongside patients year after year. That's why it's just as important to highlight that nearly 90% of patients reached in 2024 were continuing treatment from previous years. This sustained support reflects our long-term commitment to equitable treatment and care, ensuring not only that new patients are reached, but those that are already in treatment remain supported throughout their journey. We believe that continuity of care is a cornerstone of health equity, especially in low and middle income countries where treatment interruptions can lead to devastating outcomes. By walking alongside patients throughout their journey, we help ensure long-term outcomes are possible. Next, looking at patients who access treatment by region, we continue to see growth across almost all regions, especially in Africa. This expansion reflects our ongoing commitment to reaching underserved populations and closing gaps in access through targeted expansion where the need is greatest. While South Asia, shown in yellow on this figure, continues to account for nearly 40% of all patients, we observed a gradual decline in numbers, particularly in India and Sri Lanka, as local access pathways have strengthened. So the main reason for this is that as economies develop and medicines, including generics, become more available and accessible, patients are increasingly able to obtain treatment locally rather than through humanitarian access programs. This shift reinforces our role as a bridge to access and evolving our support as local health systems strengthen. By responding to these changing landscapes, we remain focused on advancing equitable access where the need is most urgent. So here we show patients reached through our accompaniment services and social determinants of health programs. In 2024, we supported 24,019 patients through at least one of these services. Over 22,000 patients received accompaniment services. So this refers to the personalized one-on-one support our Max team provides patients through their treatment journey, helping them navigate emotional, psychosocial, and practical barriers to care, communicating with patients through various platforms in person, via phone, email, text messages throughout the year. So our 6 social determinants of health programs include patient education, patient support groups, Last Mile, which is a transportation program, Day by Day, a program supporting treatment adherence, and Max Schooling for the children of patients in our program. Benefited more than 11,000 patients across 47 countries. Since 2023, the number of patients reached through our social determinants of health program has doubled. This reflects not only growing demand for holistic support, but also our expanded capacity to deliver these services and our improved data capture through our PATS system. One of our 5-year strategic goals is to double the number of diseases we support between 2022 and 2026. At the end of 2024, we were providing access to 15 treatments for 14 diseases, primarily in oncology and rare diseases through Max Access Solutions. In 2024, we expanded our portfolio by adding a new disease, ALK-positive inflammatory myofibroblastic tumors, or ALK-positive IMT, using an existing treatment in our portfolio, crizotinib. We also introduced a new medicine, abemaciclib, for patients with HR-positive, HER2-negative breast cancer. These additions reflect our ongoing commitment to broadening access to life-saving therapies and reaching more people living with critical illnesses. So here we look at the median time on treatment for patients. So the aim of this indicator is to help inform our program planning and to assess long-term patient outcomes. By examining median time on treatment by disease and long-term time and treatment trends, we gain insights into real-world outcomes and survival in resource-limited settings. Of the 28,180 active CML patients at the end of 2024, nearly 75% had been on treatment for more than 5 years, and over 50% had been on treatment through the Max Foundation for more than 10 years. Of the 2,820 GIST patients active at the end of 2024, almost 40% had been on treatment for more than 5 years, and over 13% had been on treatment through the Max Foundation for more than 10 years. So we've conducted and published more detailed long-term evaluations of time on treatment and overall survival for CML and GIST. These evaluations showed that for both CML and GIST, patients from low and middle income countries in our programs had survival rates comparable to patients in high income countries. This is a powerful indicator that our access programs have helped eliminate global disparities in survival for CML and GIST, and we believe that similar outcomes are possible for other diseases. Health equity cannot be achieved without strong, resilient health systems. That's why one of our strategic goals is to support health system strengthening in low and middle income countries, recognizing that access to medicines can serve as a powerful catalyst for broader system improvements. In 2024, our efforts focused on expanding diagnostic capacity, equipping healthcare professionals through clinical education and capacity building, and implementing quality controls to support the safe and effective delivery of medicines and diagnostics. By measuring our health system strengthening work, we gain deeper understanding into the barriers patients and healthcare professionals face and how our interventions help address them. As we continue investing in data systems and evaluation tools, our goal is to better track outcomes and impact, ensuring that our programs not only expand access, but also help build lasting capacity where it's needed most. So one way we measure progress in health system strengthening is by examining how and where our programs are expanding and how we're adapting support based on the local context. Last year, we reached patients in 84 countries across all programs. Through our treatment access program, Max Access Solutions, patients in 79 countries received access to treatment. Notably, this included first-time access in Eswatini, Gambia, and Burundi. In 5 countries, patients were supported exclusively through social determinants of health programs, demonstrating our ability to tailor support based on country-specific needs. Last year, we partnered with 378 institutions and 495 physicians to deliver Max Access Solutions. We also introduced a new treatment in 22 countries, launched diagnostic programs in 2 countries for the first time, and expanded SDOH programs to 21 new countries. Since 2022, we've expanded Max Access Solutions to 6 new countries, keeping us on track to reach our strategic goal of 10 new countries by 2026. This growing footprint is more than a measure of reach. It reflects our expanding partnerships, deepening support across the care continuum, and the progress we're making towards more equitable and resilient health systems worldwide. I'd now like to share an example of how we're building capacity on the ground. In Bhutan, breast cancer is often diagnosed too late, delayed by limited diagnostic infrastructure and high out-of-pocket costs for patients. But now that's beginning to change. Pictured here is Dr. Pradhan, our partner physician and a surgical oncologist at the JDW National Referral Hospital. He has witnessed firsthand the impact that timely diagnosis can have. Through our partnership with BD, biopsy needles have been distributed to 8 hospitals across the country in Bhutan. It's a simple intervention, but one that is easing the financial burden and improving access to treatment. This is what capacity building looks like in practice, equipping local physicians with the tools they need to deliver better care and shifting the trajectory of cancer outcomes in resource-limited settings. Achieving health equity requires strong, sustained partnerships across many sectors, and many of you here know that firsthand because you are our partners. So to track progress towards our goal of expanding partnerships, we look not only at the number of partnerships, but also the types of collaborations that are central to our strategy. In 2024, we worked with 938 partners. That includes health institutions, physicians, ministries of health, NGOs, and corporate supporters. This number is up slightly from 936 partners in 2023. While the overall number grew modestly, the depth and impact of these partnerships continue to expand. Last year alone, we welcomed 9 new treating institutions, 28 new partner physicians, and signed 2 new agreements with ministries of health, further anchoring our work within national health systems. Likewise, in 2024, we continued to grow our humanitarian partnerships for access to critical treatments, or humanitarian pact, as we call it, advancing our mission to expand equitable access to medicines and diagnostics in low and middle income countries. So key additions to Max Access Solutions included a new treatment for PNH, a rare and life-threatening blood disease, and core biopsy instruments to strengthen breast cancer diagnostic capacity. We now collaborate with 7 pharmaceutical partners and 2 diagnostic partners, moving us closer to our goal of 10 active humanitarian pact partners by 2026. With strong momentum, we are well positioned to double the number of partnerships in the coming years, broadening the treatment and diagnostic landscape and deepening our impact across more diseases, more countries, and more lives. Access to diagnosis is critical for timely treatment and improved outcomes. Yet in many low and middle income countries, patients face major barriers to accessing essential diagnostics as well as monitoring. So our goal is to help reduce these gaps by expanding access to high quality tests and tools to support diagnosis and monitoring that is critical for ensuring continuity of care and improved outcomes. In 2024, we advanced this goal through several key initiatives. Firstly, through our partnership with Cepheid, partner institutions in 68 countries can access GeneXpert PCR testing free of charge or at a preferential price. Secondly, in select countries, we subsidize local laboratory testing to reduce the out-of-pocket costs for patients. Thirdly, in collaboration with the Radich Lab at the Fred Hutch, we offer free spot-on CML testing. So this is using dried blood spots sent via regular mail to conduct BCR-able analysis. Finally, for the first time in 2024, we distributed biopsy instruments to strengthen breast cancer diagnostic capacity at partner sites. 2024, we provided 9,936 diagnostic tests and tools across 38 countries, representing a 36% increase from 2023. This growth reflects both rising demand for molecular testing and improved capacity among partner institutions. Looking ahead, we aim to evolve our measurement approach from tracking volume to assessing patients reached, diagnostic turnaround time, and impact on treatment outcomes to better understand and close diagnostic gaps where the need is greatest. Now I want to share a powerful story about Dr. Fish, our partner hematologist in Ethiopia. Our CEO, Pat Garcia Gonzalez, met Dr. Fish for the first time in 2011 when he was finishing his residency and already living with CML. Pat had often said that when we began envisioning the treatment-free remission support program, he was the person she had in mind. So treatment-free remission, or TFR, means that some CML patients can safely stop treatment if their disease has been well controlled for some time. Through our TFR support program, the Max Foundation helps eligible patients in select low and middle income countries access the testing and support they need to attempt stopping treatment safely. In 2024, we were finally able to provide Dr. Fish with access to diagnostic tools needed to monitor his treatment-free remission. After several nerve-wracking PCR tests, I'm happy to share that Dr. Fish has now been in treatment-free remission for over a year. I'm sharing this story because this is what success looks like to us. In the middle of talking about indicators and numbers, it's important to pause and remember why this work matters. Dr. Fish's journey is a powerful reminder that real impact is measured not just in numbers, but in the lives we touch. His story brings meaning to the data and reminds us that behind every figure are human beings, families, and communities impacted by access to treatment and care. Understanding and improving the capacity of institutions to deliver high-quality treatment and care is critical for our health system strengthening work. In 2024, we conducted 17 site assessments to better understand partner institutions' ability to diagnose and treat patients and to identify gaps in diagnostic and treatment infrastructure. Site assessments are conducted using standardized forms which collect quantitative and qualitative information on multiple domains, including staffing, diagnostic pathways, and patient volume, and they complement the many site visits that our team do. These assessments go beyond evaluating just readiness. They generate actionable insights that inform our program design, guide the allocation of resources, and strengthen and support training and capacity building for healthcare providers. In doing so, they help us strengthen local health systems and improve outcomes for patients. Looking ahead, we plan to expand and refine how we evaluate these assessments, enabling us to track progress over time and more meaningfully measure the impact of our health system strengthening efforts. Our clinical training is also a key part of our health system strengthening strategy. By helping build the skills of partner healthcare professionals, we help ensure they can deliver high-quality care, make informed clinical decisions, and ultimately improve patient outcomes. In 2024, Max facilitated training for 108 healthcare professionals across 25 countries in collaboration with several leading clinical experts. So these trainings are delivered both on-site and virtually, covering key topics including diagnosis, pathology, clinical decision-making, medication management, and disease monitoring and follow-up. By investing in clinical training, we're not just improving individual knowledge, we're equipping healthcare workers with the tools they need to deliver better care. This contributes directly to stronger, more resilient health systems and better outcomes for the patients we serve. Our final objective, which was newly introduced this year, focuses on maximizing the value of investment, ensuring that every resource is efficiently used and effectively to drive impact. So today I'm going to highlight just one indicator from this objective, the value of investment. So this indicator focuses on assessing the financial value of donated medicines and demonstrating the return on investment made by our partners through the humanitarian impact. In 2024, the estimated value of donated medicines distributed through Max Access Solutions was $358.6 million. These donations supported over 37,000 patients and nearly 500 healthcare professionals across 79 countries, providing access to life-saving treatments that would otherwise be out of reach. But this is more than just a dollar figure. These contributions translate directly into longer survival, improved quality of life, and strengthened health systems in low and middle income countries. They demonstrate the powerful return on strategic investments and reinforce the value of our access model. As we scale into new disease areas and geographies, the impact of these partnerships will continue to grow, helping us reach more patients, build stronger systems, and drive measurable, lasting change. On behalf of our entire global team, thank you for being here and for your continuously supporting the Max Foundation. We hope you all found today's presentation insightful and enjoyed learning about the impact we've achieved together. If you haven't had a chance to see the full M&E report, this will be posted on our website shortly. We also hope you'll join us for our next webinar on July 17th, where our CEO, Pat, will be joined by a special partner physician, Dr. Taladha from Nepal, to discuss overcoming barriers to pediatric cancer care in Nepal. Thank you all again. I'd now like to open the floor for any questions, comments, or reflections you may have, and I'll be joined by my colleague, Charmaine, who'll help moderate the discussion.
Thanks so much, Alicia. I would just like to invite anybody that might have questions to please add them in the chat, and we'll address those. Alicia, we did have a question earlier in the presentation. Hoping you can help clarify what we mean when we refer to accompaniment services.
Mm-hmm. Yes, so accompaniment services are the one-on-one individualized support that our team, our Max team on the ground in the countries that we work in, provide to patients. So that's through phone calls, sometimes through face-to-face meetings at patient support group meetings, text messages, emails, but really that continuity of care, calling patients, seeing how they are in their treatment journey, but that contact with patients one-on-one.
Excellent. Thank you so much. We have another question in the chat. I think that will actually be addressed with a couple of similar questions that we had earlier. But first, we did have a question about addressing gaps in breast cancer. How do you plan to address gaps in breast cancer diagnosis, pathology, biomarker testing, and treatment in low and middle income countries?
Yeah, thanks for that great question.
Mhm.
So, addressing gaps in breast cancer treatment and diagnostics in low and middle income countries is definitely a priority for us. In 2023, we launched our very first treatment access program for advanced breast cancer. And since then, we've reached nearly 500 patients across 13 countries with access to innovative combination therapies for breast cancer. As I've tried to showcase in the M&E report, our approach is really multi-layered. For the breast cancer program, we started our implementation planning by conducting these capacity assessments to understand each country's unique capacity and needs. From there, we worked with various partners to help strengthen capacity. So far, in addition to providing access to treatments, this has included a clinical and pathology training for healthcare professionals, and these have been facilitated for breast cancer in collaboration with experts from the ABC Global Alliance and other groups. We've provided diagnostic tools like the biopsy needles, as well as supporting patients through their journey with, our accompaniment services, with patient education and other social determinants of health programs. Another exciting development is through our partnership with Cepheid, we have access to PCR tests specifically for hormone receptor and HER2 testing for breast cancer diagnosis. These tests are relatively new, so we're working now with a few institutions to validate these tests against the gold standard of immunohistochemistry and implement these tests more broadly. Our goal is to close gaps across the entire cancer care continuum from diagnosis to treatment of care to follow up, while using treatment access as a catalyst to strengthen health systems.
Thank you so much, Alicia. We did have a question in the chat just specifically about breast cancer treatment in Nepal and connecting to get help. How would you advise somebody reach out to get more information on the programs that we're running in Nepal?
Yes, great question. I know we had a few of these prior to the webinar as well. Requests for access to treatment. We understand how important access to treatment is, and we take every request very seriously. So if you have a request for yourself or a family member, for a treatment in your country, we encourage you to email us directly at the Max Foundation. Our email address is on our website, and we can post it on the chat. We want you to know that our team tracks and reviews each request. And, while we may not be able to provide immediate access in every case, these requests are critical because they help us advocate for expanded access with our partners and guide where support is needed most urgently.
Great. Thank you so much. We do have a question in the chat about treatment-free remission. And I think that the question asker is wondering if every CML patient is eligible or able to qualify for treatment-free remission, or is it just in certain cases? If you could clarify that.
Yeah, so our treatment-free remission support program started in 2021. We started in select countries, and we now have about 8 countries where the program is open. Our criteria, given that this is the first time treatment-free remission has been implemented in low and middle income countries, our criteria is a little bit more stringent than that. Than clinical guidelines in the US and Europe. So we do have a strict eligibility criteria. One being that patients must be on TKI on a treatment for at least 10 years in an eligible country. There are other criteria that we follow. We know that there are many patients in our program that can attempt treatment-free remission because they have been on treatment for more than 10 years, and we are hoping to expand support for that based on the need.
Excellent. Thank you. There's a question in the chat about our plans for expansion into other treatments or other therapeutic areas. Can you talk a little bit about the future and what our plans are?
Mhm. Yeah, our plan is certainly to expand into new disease areas and to increase the number of treatments in our portfolio in oncology and rare diseases. So, most recently, we have added breast cancer as a disease in our portfolio. Chronic lymphocytic leukemia is another new disease area. And most recently, PNH, which is a very, very rare blood disease. We are continuing to expand our portfolio in terms of treatments for diseases that already exist, as well as new disease areas, based on the need that exists. And that's why hearing about, the treatments that you need in the countries are very important for us for guiding this strategy.
Great. I think this has been answered a little bit, but could you speak a bit more to the criteria that we follow in order to launch a program in a new country, and also extension of that, any challenges that we face in expanding programs in particular countries, and perhaps some examples.
I'll use the example of breast cancer. So in 2023, we launched our first breast cancer program, providing access to treatments for advanced breast cancer. Um, Before we start a program, we have an eligible list of countries. So not every treatment can be provided to every country, and it's really based on our partnership with our donors. And so we have a country list from which we work in, but we also do these capacity assessments to understand that the institutions that we work with have the capacity to diagnose and treat breast cancer. And then from there, we're able to really support with the gaps in whether it's training or diagnostics or general capacity building, really ensuring that when we are providing treatment, we're supporting with the broader landscape around that.
Great example. Thank you, Alicia. One of our partners in Rwanda is wondering about patient navigation programs, the recognizing the health system difficulties. Can you elaborate a bit more on what we're doing to help patients navigate through their treatment?
Yeah, so we have a few programs under our umbrella of social determinants of health programs, really um, addressing patient support and patient navigation. So in some countries, we have helplines. So these are open to patients, not only in our treatment access programs, but any patient in the country, really supporting patients with various, practical or social needs. We have another program called Day by Day, and that's primarily for patients that we do not support through treatment access. And as our programs evolve and as patients move off humanitarian access programs to local pathways, we've identified that there still is that need for support and patient navigation. and day by day addresses this. So we have that in a few countries, but really we do have various programs within our social determinants of health umbrella that addresses this patient support and navigation. And then, of course, the accompaniment services that we provide to all patients in our programs.
Great, thank you. Jasmine had a great question in the chat here. With our expansion into Eswatini, Burundi, and Gambia, what indicators are we using to track whether partnerships and diagnostic access are effectively reaching those patients in those new settings?
Yeah, good question. I shared in the M&E report a few indicators measuring our work and health system strengthening. And admittedly, those are primarily outputs. We looked at the number of tools and tests that we provide and the number of partnerships we have. And the goal is to really strengthen those evaluations and to look within a health system at what's evolving over time and how our support has helped to strengthen health systems. And so as we go into new countries, we have started doing baseline assessments, baseline capacity assessments, and the goal is to, every few years do those assessments again and to measure the change and to try to attribute that to some of the support that we've provided.
Thank you so much. Um, There is a question from Carlo in the chat. Can you talk a bit more about whether Max manages the needs for supportive care medicines for any AE management?
Yeah, most recently we've added innovative therapies to our portfolio that are combination therapies. And this is the first time we've had our combination treatment therapies in our portfolio. And so we do support specifically with the additional therapies that are needed for combination therapy. In terms of supportive medications, more recently we've identified supportive treatments medicines that are quite critical for patients being treated by these innovative therapies, and we are working to get access to them for patients.
Great, thank you so much. There is another question in the chat. What are the limitations that we have faced to enter any new countries in any new low and middle income countries, even after 20 years of treatment being established?
Yeah, that's a great question. We work in almost 80 countries, 80 low and middle income countries, which is a lot of countries. And, when we first started providing access to treatment for chronic myeloid leukemia over 20 years ago, many countries didn't have access to diagnostics. But that wasn't a barrier for us. We believe that, you provide treatment first and then you work to build the system, the ecosystem around that. And and that has proven to be true. In 20 years, we've established diagnostic capacity for chronic myeloid leukemia in every single country that we work in for CML. And we believe that this is possible for the other newer disease areas that we're working in, such as breast cancer. And so limitations um, are many, and many of you may have watched Pat's webinar recently on the wall and the barriers that we face. But, diagnostics is a key one. And in terms of entering into a new country, sometimes it's having the partner institutions and physicians to work with, as well as regulatory challenges. But, those are all barriers and challenges that we continue to face and work with every day. And we believe that medicine really serves as the catalyst for breaking down a lot of these barriers.
Great. Thank you so much. We have had a lot of engagement in the chat. Thank you so much, everybody. I'm catching up. I'm hoping I'm not missing any questions. If we did miss a question in the chat, we will be sure to follow up. I do have one final question. Thank you so much, Alicia. This is an amazing report and really highlights the importance of the work the Max Foundation is doing. What do you see as the most exciting opportunity for the Max Foundation in the coming years? What are you most excited about?
Oh, wow. There is, Charmaine, that there is so many exciting things happening at the Max Foundation. And Despite everything happening in global health today, we've continued to push forward, and we're fortunate that we're able to do the work that we do and expand the work that we do the way we've been doing. I think what excites me is the continued expansion, expanding into new countries and new disease areas and serving more patients. I think the Max Foundation is also really evolving our approach. We've always been a bridge to access, and I think now we're really showing that. We're really showing that through different, access pathways, and through different partnerships, particularly in the public sector. And I think I'm excited just overall for the expansion and the various ways we're continuing to support patients.
Great. And we will continue to keep everybody up to date on the work that we're doing. Again, just really encouraging everybody to sign up for our newsletter. If you have follow-up questions after this presentation, please do send us an email. I'm going to drop that in the chat here. But thank you everybody so much for joining us. Alicia, any final words?
No, just thank you for joining us. Your support, is critical for the work that we do. If you do have any questions or reflections, feel free to email me directly or the team here, and we will certainly get back to you and we can share. We have a full report with a lot more data and information and figures that we are happy to share externally. But thank you, everybody, and have a wonderful day.
Thanks, everyone.